Surgery is scary enough for many patients, but imagine being one of the 1,500 people a year that has gauze left inside of them.
Well, the complications from that can be very serious. And in one study, it happens more often in C-sections than other surgeries. But there is one local hospital that we visited today who showed us the latest and greatest technology that they got only 2 months ago that will not let a surgeon sew you up if there is anything left inside. Dr. Bill Irvin is an obstetrical surgeon. One of his top surgical tools is a laparotomy pad.
And we can wrap it around certain organs and pull those organs out of the way to expose an area that we're operating.
As useful as they are, they have become a nightmare for patients when left inside of them.
As they absorb blood, they get very compact and small, and they will actually start to look somewhat like some of the surrounding normal tissues inside the patient we're operating on. These can cause severe infections inside the patient. These can cause erosions into organ systems such as the bowel.
For this reason, the new RF Assure machine inside of his operating room gives him a sense of peace.
This takes the human component out of it. We don't have to worry if someone counted 25 when in fact there were only 24.
Nurse Jamie Gerard explains how the patient is laid on top of a wired black pad. Before they close up the wounds, they run a scan to see if there's any gauze left inside.
Red detection, so that's showing that there's something left inside the patient.
The mat and the wand picks up a tiny microchip that is in every pad.
There's a little tiny tabby thing.
It responds to the radio frequency of the machine.
And typically only use wands for extremities and larger patients.
Riverside Hospital is not removing the people who are responsible to count the pads. They're just no longer relying on them alone. The hospital got the equipment for free from RF Assure, but they pay $60 grand a year for the supplies that it takes to maintain it. It is cost effective compared to the $1 million lawsuits filed by each patient all across the country in the past.